Hi, I'm Tyson Franklin, and welcome back to this week's episode of Podiatry Marketing. With me is my co-host, Big Jim McDannald. So, Jim, how you doing today?
Feeling bigger than ever. I've been working out, getting huge, and things are good here in
Have
Montreal,
you been
Quebec.
working out? Do you do weights?
I do 3 times a week now, hit the gym and try to get into those middle 40s. You got to realize that the muscle mass is going to get less and less over time. So you got to be proactive. I got 2 small kids I got to try to keep up with. So yeah, I'm hitting the weights.
That's a good idea. I got a friend who he is probably late 40s, I'd say. It might be 50. I don't think he is. I've insulted him if I said he is. And he just told me recently that the last 6 months of last year, he hit the weights and he's put on 6 kilos extra of muscle just by hitting the gym 3 or 4 times a week.
Yeah, I think the running that I do keeps it off. I'm not a bulky guy, but definitely feel a little stronger than I did before I started. So
I went for a run yesterday. It reminded me why I don't run.
there you go.
Yeah. Yeah, I'll just stick to kickboxing. So much easier. So what are we talking about today?
Yeah, so today we're going to jump in a little bit about direct care and ways to market a direct care practice. I think I've been spending more time on LinkedIn this year and met some great folks there, and a lot of them are chatting a bit about direct care or kind of fee for service practices. I
Yeah.
think that there's definitely a lot of people out there that whether they're totally committed in the US to just fee for service versus there's a hybrid of some practices that have these fee for service modalities or treatments, and how do you work that into your marketing, or how do you get started in highlighting or showcasing some of those treatments, but just feeling comfortable with that and ways to communicate that to prospective patients and also patients that are in the clinic.
So to explain this to people, say, who are probably in the UK and Australia listening to this, the North American system is a little bit different. And that's what you're talking about, isn't it? Because a lot of podiatrists in America they have to deal with insurance companies. Everything is really revolved around insurance companies. So they're now looking for services and products and things that they can do where it's just a cash payment directly from the patient instead of having to go through insurance companies. I don't mean cash under the table, like illegal stuff.
Yeah, you're going to hear a lot of different names for it, like concierge podiatry or direct
Oh, okay.
pay or fee for service. And like you're talking about, if you're opted into a certain insurance plans or you take Medicare in the United States, the government payer, you're limited to as far as the amount of the kind of fees you can charge for certain types of procedures. But there are procedures that aren't not necessarily coded, or if you're opted out of Medicare, which is a whole process, which I don't know personally a lot about, but there's some folks I could probably recommend people chat with about that. But if you're opted out of the Medicare or Medicaid system in the US, you're able to basically provide transparency as far as cost transparency. Obviously, the having insurances in the US, these kind of HMO, these health management organizations, or these PPOs in the US kind of cause a lot of paperwork or additional bureaucratic work for practices.
Yeah.
So there's some people that these days have, whether it's fully direct pay or concierge podiatry, or there's not certain services like someone that is in practice taking some insurances can do some of these cash pay procedures. I think common ones would be in the US, like the Swift warts removal, sometimes like different types of laser or other types of treatment as far as the kind of hybrid. But then you have these people that are completely cash pay practices, which is, I don't know how common it is, if that even happens in Australia or the UK.
Are you chatting with them about how they're using this service, or is it about have you thought about using the service? What sort of conversations are you having with people?
Yeah, I would say there's, like I talked about, the amount of kind of bureaucracy and paperwork that is required to do certain either in surgeries or certain procedures in the US makes it very onerous from a time perspective for not only the doctor, but for their staff. It feels like there's kind of some momentum in the United States of people banding together to, like I said, have price transparency, right? Just because someone has insurance doesn't necessarily mean that. It's nice to have that kind of, I would say, like safety net. And me
Yeah.
living in Canada, like I'm very aware that they don't pay for a lot of elective procedures to be done here. But if I were to get hit by a bus or fall out a window or something, I'll be taken care of.
You live a wild life, Jim.
Me,
You get hit
me
by
here
a
in
bus
Montreal.
or fall out a window. I'm
Or you
thinking,
break
my
your leg
God,
on the ice when you're skiing or skating or something. Some good Canadian stuff. But
I'm just picturing you falling out of a window on a bus.
there you go. But it is one of those things, right? If it is something where an ingrown toenail or there's certain helpful treatments that are not covered by insurances, sometimes a fee for service model can be a benefit to the patient and knowing that's available. So when I talk with folks on LinkedIn, they're talking about how they did it. They're a group of people that I would say that are really open to sharing information about how they've done that. But it can be an adjunct to insurance procedures or providers that haven't opted out of insurances or Medicare necessarily, but there's certain procedures, like I said, Swift or other things. Sometimes people would incorporate into the practice to boost the bottom line of the practice.
So can it actually work out cheaper for patients to not go through their insurance company?
I think in some cases, I think when we're bulletproof, maybe from the ages of 22 to 35 before we start falling apart, maybe
Yeah.
there are some benefits of having that, or even getting a plan that has a relatively high deductible and just paying cash pay for a period of time for more smaller elective things. They don't have to, the coverage doesn't get bumped up in the US. Sometimes your coverage can get more expensive over time.
So you're saying if somebody is with an insurance company and they have an ingrown toenail, if they go and see the podiatrist and the insurance company pays for it, but their premiums could go up the next year because they actually made a claim.
They could just go up in general. But if you're
Yeah.
getting a higher deductible premium or a higher deductible plan with a certain provider, maybe you have the first $1,000 is on you, or the first $2,000 is going to be much cheaper to pay for that plan as opposed to someone that's trying to
Okay.
have everything covered. If your deductible is only $50, for sure per month or every quarter, that's going to be a much more expensive plan for somebody. But if you're relatively young, healthy, maybe in your younger days, you can get away with a higher deductible. Have that kind of safety net because it's private insurance primarily, but you're not going to the well or doing that every single time. So there's different ways. This is not really about the insurance, the reimbursement, but there's definitely reasons why people will consider cash pay versus more insurance covered providers.
Okay. And I want to point out to anyone who is not in North America, who doesn't have to go, isn't faced with this sort of problem as much, still take on board some of the advice that Jim shares, because you might think, instead of saying, oh, no, that doesn't apply to me, just think about how can I make that apply to me? Because they're sure to give me ideas. Because how does someone get started changing their business or moving in that direction?
Yeah. So I think the first really step people should make is to, number one, talk to somebody that's done that before. You don't have to reinvent the wheel. I think sometimes, me personally, not that I've ever done it before, but sometimes you just think, oh, I'll just do that. But I think there can be real benefit to understand that if you're going to walk down that road, talk with someone that's been down there before to see what the trials and tribulations were. If you're considering either bringing something like a certain modality into your practice, have you done that before? Have you brought in a laser and never used it?
Yeah.
Do you have kind of systems in place that if you do something that's more cash pay, whether it's just a modality, before you just dive off the deep end into more of a direct pay practice? I think it can be right for the right person, the right location, but it's probably not something that's going to work for every personality or for every, you have to be relatively, I'd say, business savvy and wanting to really explore it. If you're in a small little rural area that's not very wealthy or doesn't have that type of patient in the local area, maybe not a good fit. So by talking to somebody, I think is step number one. I think also you have to learn how to communicate the differences between what is someone getting by going to a cash pay
Mm.
doctor or a direct pay versus going to an insurance provider. Maybe they're able to see you that day. There can be definitely some different benefits. How are you going to highlight and differentiate yourself from other competitors? Because now you're not accepting a lot of payers that other people are. And it might be a little bit of a change for some people to understand, why don't you accept my insurance? So you have to communicate on your marketing material, on your website, probably when they call your clinic, to make sure that they don't feel duped. If they come into your practice, hey, you don't accept that insurance. Everybody does. You don't want to set up those situations. It's a lot of communication, like I talked about as well. Price transparency can be also a huge marketing factor as well, by just saying this is what we charge. I've seen different, I would say, like surgery centers in the US that are only cash pay, have that price transparency, which can be beneficial. But it is one of those things where, whether it's getting into direct care, if we're going to kind of practice in a different way, I think it's very beneficial to talk to people that have been down a similar road. I'd say, especially in the direct pay concierge podiatry area, people are very open to
Yeah.
discussing what these things are. And there's no special secrets, or I'm not going to tell you. Someone's practicing in Maine and then someone else is in California, somebody's in Florida. There's not like a concierge practice in every locality. So you're going to find a lot of camaraderie amongst people that practice in this manner.
So when you say no to a particular insurance company, does that mean you're saying no to that insurance company across the board on all services? Or is it just,
Uh,
I'm not going to take that insurance company for nail surgery, or I won't take it for doing routine foot care?
So I think it really depends, but I think for the most part, once you opt out of an insurance provider, like you're opting out of all of those things they would cover for patients.
Do
So
you get
it
the
is,
shits with that? Does the insurance company go, what are you doing? Why won't you accept these patients? Do they contact you and
I mean,
say, "Hey, what are you doing, Jim? You're killing us."
I've not done that personally. So, like I said, I'm speaking from some of the conversations I've had with folks on
Yeah.
LinkedIn. Definitely, if people are curious about this way, they can send me a DM, send an email to the to our podcast here, and we can get you set up with some folks that have gone through it. But I've not experienced that, so I really I don't know what those conversations are like.
Oh, right. Okay. Yeah, I wasn't sure because I could just because our insurance companies over here work completely different. It's mind-boggling what what happens in North America in comparison. So if somebody wants to head down this path, okay, the first thing is they start talking to other people that have done it, try and learn from them. Is there a way that you start small, like you only one insurance company first, just to see how that feels, and then you slowly expand from there? Or is it's always going to be a hybrid? There's always going to be some insurance companies you will work with because they're great, and there's other ones that you're just going to can pretty quickly because then,
From my understanding, it's a real spectrum, to be honest. From region to region in the US, there's going to be
yeah,
different insurance providers, and some maybe pay okay and others pay horribly. So you can, from my understanding, you can pick and choose which ones you want to. I'd say my real focus here today is to probably work more on the marketing of how you're going to communicate those different things as opposed to really the dirty details, the nitty gritty as far as which are those insurances to drop and how did it happen. But I
yeah,
think it is one of those things where it's probably like I talked about, there's a few folks that I'm aware of that could probably talk about their path about when they dropped what insurance plan and how they either gradually transition from accepting everything to to nothing and opting out completely. I know that there's, like I said, there's some of these procedures or modalities that are not covered by insurance. So they are up to have that conversation with the patient about we do have this other form of treatment that's highly effective that insurance doesn't cover yet. So that's a
yeah.
skill set and something people have to work on. So I guess
And that
like I
becomes
said,
part of your marketing. That's like you said. So you have a service. So it's like when Shockwave first came out, or
right,
laser for fungal nails. It would have taken a period of time for the insurance companies to catch up to that.
right. And sometimes they haven't. Sometimes there's off uses for some modalities, right? It's not just the modality itself. Maybe it's like you can't use this laser for a wart, but you can use it for some type of the other ablation or something like that, right? And it's not the code isn't there, so it's an off use that they're not going to cover. But
Yeah,
it's how do you communicate that? Like I said, not only through you talking directly to the patient, but what are the ways that you when they come onto your website, utilizing your digital marketing channels to make sure they feel informed and it's very upfront to them about that you are providing this type of service because you don't want that surprise coming to your practice. So that includes the copy on your website. It's how you're highlighting making different pages on your website, whether it's transparent pricing. I've seen there's some really good websites out there that some of the concierge podiatrists and the direct pay podiatrists are utilizing that you don't have to copy paste what they do, but you get a general sense of how they're educating the patient before they come into the practice to make sure they understand what the pros and cons or what the benefits versus the differences that they may experience in a normal patient encounter if someone's used to like going through that kind of insurance dance that they're used to when seeing a podiatrist. But I think, like I said, utilizing those digital marketing channels, whether that's through SEO, your website, improving the kind of overall visibility to make sure that it's when they land on your website that they're aware that either nothing is covered or there might be certain procedures that require cash pay.
so I was going to say, so when people are first starting this, normally they will, if they're setting up their own business, when somebody's setting up their business for the first time, normally they will just take all the insurance companies on board. And then it's not until they've done that they then start making the changes. It's rare for someone to try doing this right from the start. Or do you think it's a good idea for people that the sooner you can do this, the better?
I think that's going to really vary between individual, right? I think that, like you said, the kind of most common places you put up your shingle and you're wanting to get revenue in the door, so you're
Yeah.
willing to bring on every payer. And I think it would, unless someone maybe has a parent who has a direct pay practice or a direct care practice, they may not have. You're busy in school, you're busy in residency. Even me, I didn't really think that this was something that was a possibility when I was going through residency or school. I don't know how other people, how their listeners if this is something that's more prevalent nowadays, I graduated, I guess, I hate to age myself, but I think it was,
Yeah.
I
Yeah.
graduated
How long ago did you graduate?
20 years ago from school
Yeah.
and 17 years ago from residency. So maybe things have changed and it's more of an option, but I think it is one of those things where it's communicating it once you figure out what that path is for you to go towards that direct care path. But I think there are ways besides just digital marketing stuff. I think it's pretty common. You're not depending on what province you're in or what state you're in, some people are used to paying more for healthcare or allied healthcare services, like getting networking with some of these other providers, like massage therapists. Maybe there's some physios. Maybe there's other people that are in a similar kind of referral network. Kind of talked about these kind of both medical or non-medical referral networks that are
Yeah.
used to. The shoe store is not used to like having to reimburse an insurance plan for someone's orthopedic shoes or something. Sometimes you'll get custom shoes for diabetics, but I think it is important to solidify this network of local businesses so that they understand the benefits. Like I talked about, communicating these benefits of your direct care practice versus, oh, this person is, they have a 3-month wait. They only accept these insurances. There are definitely ways to differentiate yourself from some of the other clinics in town that can be beneficial for these other local businesses to know about.
Yeah, because like you said, there's the whole online world that you can actually market and tell people what you're doing. But offline, like you said, communicating this to other businesses, but I assume going to health fairs, expos, anything where you can actually connect with the community would probably be a good idea as well.
No, I think that's a perfect example, right? The more chance you have to communicate, because it's sometimes it can be hard enough to communicate like all the foot and ankle care we provide or what our
Yeah.
area of expertise is. But this is like one more layer of explanation to people. And like I said, you don't have to necessarily reinvent the wheel, but if maybe you're putting on biannually like open houses at your practice to help educate your community about why you're a direct care practice, what are the benefits in person so they can, it's not just something they land on a website or have to read, but they've actually been inside of your practice. I've seen some different podiatrists utilize an open house model in a way that can be very beneficial. So that's one thing that I think people can utilize. But like you said, community events, community speaking opportunities are a real way to communicate your message about how you're trying to practice medicine in a different way that is more patient focused. I think one of the big selling points as well is that if you're taking insurances and they're not paying at a reasonable rate, either you can see more patients and spend less time with patients to try to generate the same amount of revenue, or some of these alternative ways of practicing would allow you to say, if you want to spend 30 minutes or 45 minutes with a new patient, have conversations, really get to know them and really try to like treat their problems in a way that you feel comfortable with. It provides a different way of practicing that maybe the current model with insurance plans and HMOs and PPOs, it's not impossible, but maybe it's a different way to practice that maybe some people will find attractive.
But wouldn't there be, what percentage of patients wouldn't have insurance? Is there, over here, for example, for podiatry cover, it'd be at least 50% don't have podiatry cover at all with insurers. And we have like insurance for like hospitals and surgery and all that. But then allied health is a separate thing that you pay for. And probably 50% of our patients didn't have any coverage for podiatry. So would that be the same case in the States?
Yeah, like in the US is so big, it's going to really vary. I think there are some different ways in the United States that people try to save up money for healthcare expenses. So sometimes people will utilize, like you have a health savings account called an HSA in the US where you can put away money, I think either tax deductible or tax free into this
Yeah.
account. So it's one way that sometimes you can pay for some of these services that either your insurance does pay or doesn't pay. There's definitely certain criteria you have to match in order to get, if you're being treated through Medicare. Medicare is a plan in the United States for people that are more of retirement age. So you're not going to be in the other, if you're younger than retirement age, you're on these Medicaid plans, and they're usually bare bones, very emergent safety net type of care
Is that like
plans.
a
So
Obamacare?
we don't need to get into the
Yeah, I won't
politics of
get it.
that.
Yeah, I
That's going
won't get
to
into
be a
that.
whole other can of worms. But it is one of those things where if you are, like for me, for example, I'm a business owner in Canada, I come from the US. If I were to be in the US and try to have to pay for my own health insurance, it would be prohibitively expensive, very
Yeah.
expensive to buy your own plan, depending on what state you're in and what's available. And that's a whole nother discussion. When I'm here in Canada, I have this kind of baseline of safety net. And there are some safety nets in the US, but it's not quite as comprehensive as it is here. But I think to me, the direct care or the concierge medicine it's going to be right in the right location, right? Someone that wants a high level, usually happens in affluent areas, or people that are willing to want to be seen today or tomorrow, that want to have a high level of care, are willing to pay out of pocket for it because they just don't want to wait for that patient at maybe their husband has a plan or they have a plan from work, but the three providers that are allowed to see are booked out for 3 months or 4 months, and it's not emergency room worthy. So what are you going to do in the meantime? And if you have the means, instead of limping around on that heel that's bothersome,
Yeah,
maybe
makes.
maybe it makes sense to go see the podiatrist in the meantime.
And that's
Uh,
all part of the marketing, though. That's all the part of getting that message out to the patients that, hey, you don't have to wait 3 or 4 months to see this person. I could do this for you now, or a lot quicker, and get you out of pain.
Yeah, exactly. And I think there's also been a proliferation in the United States where everything used to be pretty much hospital based. Oh, you're hurt, go to the ER. Oh, you're sick, go to the ER. But
Yeah,
in the US, they've transitioned now into, and there's been mixed reports whether this has been working well or not, these kind of urgent care centers in the local strip mall. Go to the urgent care center and have this taken care of. And sometimes those are paid by insurances, will reimburse those. But more and more, it makes sense to have some availability. And I think some podiatrists maybe even do this in their own practice, whether they're accepting insurance or not accepting insurance, is having some add-on room where that person with an ingrown toenail, that person that might have a fracture or something like that, can be worked into the schedule, and having that availability offload some of the ERs, especially during times of COVID when no one wants to go to the ER for any reason.
yeah.
Promoting that you are available and have add-ons or day of or within 24 hours receive care, whether you're a direct care practice or someone who does accept Medicare or insurances. Like I said, it's a real spectrum of what's available out there, but I think there are ways to make that more visible and communicate that to patients in your local area.
Okay. Like I said, this is probably one of those areas that, being in Australia, we I can get my head around it because I've been over the States so many times and spoken to so many podiatrists, so I understand what they've gone through and why they're trying to make the change. But I'm so glad our health system is different. Do you always hear? You just hear. You watch TV shows, and everyone, when they get a job, they want to know, oh, does this come with full medical and dental? Seems to be that's the job that people want. Whereas over here, no one thinks about it.
Even in Canada, right? Like I talked about, we do have a great safety net, but if you have something that's not an emergent procedure, you're going to be waiting a while. And I think part of this kind of change too is that I don't know if it's Amazon or Uber Eats or Uber. We just expect to push an app or do something and be seen
Yeah.
within 24 hours. We want immediate care, immediate results. And at least up here, that's not really possible. So I've actually gone to some fee for service providers in Canada because I didn't want to wait 6 to 8 months for a health checkup, right? I wanted to, I want to be proactive about my health. And the system wasn't actually giving, they would give it to me eventually. But if you do have questions that need to be answered, just for that peace of mind, you can balance it out. I do have that safety net, but if I want to be seen within a year for something, maybe Australia could teach the Canadian system here a little something. And maybe, yeah, it's no system is perfect, but it is interesting, these kind of different ways of practicing and these different ways that patients can receive care pop up as good alternatives.
Yeah, and like I said earlier on, someone from a different country may be listening and say, we don't have that problem, we're not faced with that problem, but you can still take on board everything about how you actually market your services to the general community. Is you need to do it anyway, regardless of whether it's cash through insurance company or whatever. You should be out there letting everybody know what you do.
I think it's important just to have some general awareness that this is a thing, right? Even if you're
Yeah.
in the UK or in Australia, because like I said, when I was in
And it
school,
could be headed your way.
when I was 20
Yeah.
years ago, this is not something that I even had a
No.
passing thought about. So yeah, like it definitely is probably more of a North American, US based episode today, but hopefully that the UK and Australian listeners can, maybe they're more thankful to be where they are today as opposed to in North America.
Yeah, and things are always changing. So I think it's always fine. It's always good to be aware of what's happening in other countries, because every now and then your government or organizations and insurers will see what other people are doing and go, maybe that would work here. So they just start doing it. So Jim, I think that you've covered that pretty well.
Yeah, thanks, Tyson. It was a good chat, and look forward to the next one.
Yes, I'll talk to you next week. See you later. Okay, bye.